Is your baby squint? They can go blind forever in the weak eye and cannot be recovered even if the squint is surgically corrected too late. So know how to check if your baby is squint and what to do about it immediately. I'm Dr. Chris, MD. I'm helping mums to be happy and raise healthy, happy babies. Now, as a family physician, I've delivered more than 1,000 babies like yours, and I've coached tens of thousands of mums just like you, of course, with their newborns. You have to know what goes on here because your baby may end up cross-eyed or lazy-eyed, and if not treated, lose their vision permanently or go legally blind in one eye, especially if these conditions are ignored. So lean in and I'll tell you exactly what you need to know rather than get your stomach all tied in a knot because you're trying to figure this all out on your own. That's what I'm here for. I make it easy peasy popsticks for you, right? So strabismus comes from the Greek word strabos, meaning squint, which means cross-eyed. So strabismus, the medical term for cross-eye, is a problem with eye alignment, in which both eyes do not look at the same place at the same time. So amblyopia comes from the Latin word ambly, which means dull, and opia is eye. So they have a dull eye, or we also call it a lazy eye. Now the medical term for lazy eye is a problem with visual acuity. That's what it's describing, not in focus or blurry vision of the eyesight. Amblyopia, many people make the mistake of saying that a person who has cross eyes is lazy, but a cross-eyed strabismus and the lazy eye, amblyopia, are not the same condition. Yes, strabismus, they often lead to amblyopia in a condition like 91% of the cases. If you little squint, then the eye will start getting lazy. That's according to the American Academy of Ophthalmology, especially if it's untreated. It happens because when the baby's brain gets two very different signals or pictures from the normal and the squint eye respectively, it cannot process them together as a 3D picture, so resulting in a poor and blurry observation or experience. So the brain then desperately starts rejecting or switching off or making the disturbing bad eye lazy and making it dull. That is why it is very important to see your doctor or an eye doctor or have it properly tested. Now, if you have even the slightest suspicion there is something wrong with your baby's eyes, then especially after 6 months of age, and always trust grandma's suspicion. You know, if grandma, she's had a lot of babies, she's had experience, if she says something, you know, take heed and pay attention. Important for your baby is that both strabismus and amblyopia or a dull eye are treatable conditions is by a vision therapy specialist. But if it's ignored, it will result in permanent vision loss or even legal blindness after a year or more. Okay, let's compare these two. Strabismus occurs in about 4% of the population, is also known as cross-eye, squint, wandering eye, deviating eye, or wall eye. I put two portraits up here for you to see how the baby experiences this. So strabismus is a condition whereby the eyes do not look in the same place simultaneously. Either one or both eyes can point up or down or in or out. This can either be constant or intermittent. Now, amblyopia, occurring in about 3 to 6% of the population, is also known as lazy eye, tired eye, or defective eye. I show a picture here of portraits that you can see how the baby experiences this. Amblyopia is the lack of development of clear vision or acuity or sharp picture in one or both eyes. Now, for reasons other than what cannot be improved with glasses alone. Okay, so symptoms of strabismus. There's an observable eye turn. They have poor depth perception. There's eye strain and eye discomfort. They're pinching the eyes like this, or they pinch close the crossed eye. They close that one so they can see properly with the one eye. So there's also eye or general fatigue. They get tired with the eye if they read or focus. They get headaches, difficulty reading. They can appear clumsy, difficult with agility or sporty activities. Okay. Please subscribe and click like if you're getting value from this video, so then YouTube will show it to more people and they can also get value. Symptoms of amblyopia. So it's very difficult to detect as there are no noticeable signs. The baby gets annoyed, cries or fusses when you cover or block vision from the good eye, so they're forcing him to look with a fuzzy eye. There's also poor depth perception. They can have difficulty catching or throwing objects because they don't have the three-dimensional vision. They can appear to be or have clumsiness, shutting an eye, head turn or tilt when they're looking at you or at something. And there's eye straining, so they strain like this when they're looking at something or they're frowning. There's also fatigue doing things near or close up to them and they stop doing that. Okay, let's look at diagnosing. So strabismus, even if intermittent, it can be observed and then diagnosed during an eye examination. That's very important to know. Amblyopia is also diagnosed during an eye examination. Since amblyopia occurs inconspicuously in one eye only, so that you don't notice this happening, many parents and children may be unaware of the condition. So far too many parents don't know they need to take their infants and toddlers in for an early comprehensive vision examination by an optometrist. And unfortunately, many children go undiagnosed. So we've got to make sure that we're aware of this, that they need to go in for checkups of the eye. Okay, treatment for strabismus, it may include eyeglasses or prisms or vision therapy or eye muscle surgery. Now, if detected and treated early, strabismus can often be corrected with excellent results. Now, for amblyopia the lazy eye, it may include a combination of prescription lenses, prisms, vision therapy, and eye patching. Also in vision therapy, contrary to eye patching at home, patients learn how to use two eyes together, which helps prevent lazy eye from recurring. And the home treatment is just patching the good eye, so you force the lazy eye to participate. Okay, I trust that clears things up for you. With knowledge, you can now have judgment and make the most responsible decisions. We all want the best for our babies, not so? So watch my other videos about strabism and amblyopia too to get full picture of this thing. Pun intended, of course. All right. So how are you enjoying your baby? Do you have any challenges? Comment below and I'll make more videos. Just tell me what you'd like to see or what you'd like to know about. Okay, this is Dr. Chris signing off. Ciao, mamas. Thank you for watching.